Hi everyone, welcome to Nursing with Evangel, where we make nursing education simple, fun, and easy to remember. In today's tutorial, we are going to be talking about the anatomy of the kidney, one of the body's most hard-working organs. So whether you're a student nurse or you are brushing up your basics, this video is for you. So why should nurses care about the kidneys? This is because they are vital in filtering blood, balancing fluids and electrolytes, and also producing hormones. Trust me, understanding the kidney anatomy makes clinical practice easier, especially when managing IV fluids, urinary output, or blood pressure. Now we're going to see what the kidney looks like. The kidneys are two bean-shaped organs, each about 10 to 12 cm long, roughly the size of your feet. So you make a fist like this. So the kidney is roughly the size of your fist. And they sit in your upper abdominal cavity, one on each side of the spine, just below the rib cage. The right kidney is a little bit lower than the left kidney, thanks to the liver. Because of the position of the liver in the abdominal cavity, it makes the right kidney seem low, a little bit lower than the left. Let's look at the outside of the kidney. The outermost layer is called the renal capsule, a tough shell that protects the kidney. In the middle, we'll find a notch that is called the renal ileum. That is the doorway where the renal artery, renal veins, and ureter enter and exit. So think of the ileum as the highway for vessels and veins. Now let's go inside. The kidney has three main layers. We have the renal cortex, which is the outer region, the renal medulla, which is the inner region made up of renal pyramids. We also have the renal pelvis, which is the central funnel that collects the urine and sends it down to the ureter. The ureter is the long tube that sends urine from the kidney to the bladder, and thereafter it is removed from the body through the ureter. Now meet the nephron, which is the kidney's powerhouse. Inside each kidney are over 10 million nephrons. So if you dissect a kidney now and it's beginning to count them, you get about 10 million nephrons, and they are microscopic. They actually filter blood and make urine. So each nephron has two parts. You have the renal corpuscle, which includes the Bowman capsule and the glomerulus. We also have the renal tubule, which includes the proximal tubule, the loop of Henle, and the distal tubule, and also the collecting duct. Blood enters the glomerulus, gets filtered, and flows out through the tubules, where water and nutrients are either reabsorbed or secreted. The end product, that is urine. Let's not forget the blood supply. The renal artery brings dirty blood into the kidney, and after it gets filtered, the renal vein takes it back into circulation. Do you know that 20 to 25% of the cardiac output is sent to the kidney for filtration? That's how important they are. So you don't want to joke with the kidneys at all. The kidneys are vital organs. So let's dive into the functions of the kidney. We have acid-base balance, water balance, electrolyte balance, toxin removal, blood pressure control, erythropoietin production, and vitamin D activation. I've put these functions into a simple mnemonic that is going to help you. And that mnemonic is a wet bed. The A stands for acid-base balance, W stands for water balance, E stands for electrolyte balance, T stands for toxin removal, B stands for blood pressure control, E stands for erythropoietin production, and D stands for vitamin D activation. So when next you're thinking of the functions of the kidney, you remember a wet bed. Now let's go ahead and look at some clinical tips for nurses. As a nurse, you need kidney knowledge when managing input and output. You also need kidney knowledge when you're giving medications that are renally excreted. You also need kidney knowledge when recognizing signs and symptoms of kidney injury like low urine output, edema, and confusion. So now let's do a recap. The kidneys are bean-shaped organs that filter blood. They have a cortex, medulla, and pelvis. The nephron is the functional unit of the kidney. The kidneys also help to regulate fluid, electrolytes, BP, and so much more. So let's do a quick quiz for this short lesson that we've just had. Thanks for learning with Nursing with Evangel. So if you find this helpful, don't forget to like, subscribe, and hit the bell icon so you don't miss more beginner-friendly tips and nursing tutorials like this. So drop your quiz answers in the comment section and let me know what topic you want to be next. Bye.